One bill signed into law by Governor Spanberger begins to address what many doctors call a dangerous intrusion. It's called prior authorization, when insurance companies decide not to approve payment for a treatment that a doctor prescribes. Thousands of patients across the country have stories to tell, including one teacher from Mathews County. The right health care formula for advanced math teacher Philip Sanderson, who's battling diabetes, is for his doctor to determine the best medication for him. He got a good outcome on the drug Rybelsus.
My weight was going down. My blood sugar was going down. He and I were both celebrating, had a good A1C, best A1C I had seen in a while.
But Sanderson needed a smaller dose to avoid side effects. And when his doctor, Sterling Ransom, wrote a prescription for just 3 milligrams every other day.
Something's hanging up at the pharmacy that it won't get filled. And they looked at it and they said, you've been rejected.
There it is in the letter from Anthem Blue Cross Blue Shield. We denied your request because we did not see what we need to approve the amount of the drug you asked for.
The crux of the problem is that a third party has come into that relationship between a physician and a patient.
That's the prior authorization dilemma delaying care for patients all over the country.
A lot of times patients won't try to fight their insurance company. They won't get the medications that they need. This is a huge problem, especially with our psychiatric medications.
And fighting the insurance company is enough alone to make a person sick.
It was the runaround for 4.5 months. And I just kept getting delay after delay after delay.
Inefficient, it doesn't save the healthcare system money. Lawmakers are taking notice. Governor Spanberger just signed a bill mandating that approved initial prior authorizations must stay in effect for a minimum of 6 months, 12 months for continued requests. Ransom says there's still much more to be done, like clear guidelines across all insurance companies.
If everybody basically had the same requirements, and we could more efficiently fill out the paperwork that we have to do to get the patients their care.
And Sanderson's medication was finally approved. The doctor says in some cases, AI is being used to determine if a medication should be covered by examining data.